is joining earlier. Okay, so we will start. Mm, Page 141, patient preparation position. 141, 141. This module is easy, okay? Just there is 2, 3 topics. The one topic, what is patient positioning? The other one is what is the goals or the purposes? And there is few position, the important one, like Fowler position, supine position, prone position. 141, you found it? So first of all, you can write the definition of patient positioning, okay? What is patient positioning? संजू इसके बाद आप यू डिड इट आप डेमो पेश करोगे ना एक्सरसाइज का वो जो आपने कहा था okay so patient preparation positioning is defined as planning the person in a proper body alignment okay patient preparation positioning you can write the definition positioning is defined as planning a person in the proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects of health. Okay, for the purpose of prevention. Preventive, promotive, curative aspects of health. Okay, positioning is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects of the health. Or placing the person in a good body alignment, also you can say simply short. Placing a patient in a good or proper body alignment. Alignment part is needed is therapeutically. Placing the patient in a proper body alignment is needed therapeutically. For example, if you're giving any kind of therapy to the patient, so you will place the patient in a proper body alignment. Like for example, you're giving some mechanical modality, so you will place the patient in prone position. Yes. If you're giving something here for the shoulder, then Fowler position. So positioning is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects of health, or placing the patient in a good body alignment is needed therapeutically. Okay. Now the next, what is the goal? What is the purposes? Okay, what you will achieve if you place a patient in a proper body position. So what will be your goals? Goals. So it's easy. If you place a patient in a proper body alignment, so it's mean you giving comfort to the patient. Yes. So to promote comfort to the patient and also to stimulate the circulation, okay, prevent the nerve damage, to provide proper body alignment, to prevent complications, to stimulate circulation, to prevent nerve damage, and also to prevent complications caused by immobility, to prevent complications caused by immobility. Also, you can write to promote normal physiological function, to promote normal physiological functions. To carry out nursing intervention, and also to perform surgical and medical interventions. You can also add this one, to perform surgical and medical interventions. To provide proper body alignment, also you can add, to provide proper body alignment, to promote comfort to the patient, prevent nerve damage, okay, to stimulate circulation, to provide proper body alignment, to carry out nursing intervention, to perform surgical and medical interventions, to prevent complications caused by immobility, and also to promote normal physiological functions, provide comfort, provide safety to the patient. Also, you can aid, provide safety to the patient. Also here. To perform surgical and medical interventions, to promote normal physiological functions, you can add, to promote normal physiological functions. Done, Fatima? Done? Okay. Now the next one is Fowler position, different positioning. Okay, different positioning. We will discuss different positioning. Number first one is Fowler's. Fowler position, it's like a semi-sitting position, like this. Okay, semi-sitting. You are on the bed, but the bed head is up. Okay, like you are a semi-sitting. For example, if you go to the dental doctor, you see the bed is like this. Okay, so this is called Fowler's position. So Fowler position is also known as a sitting position. You can write semi-sitting position, a bed position where the head and trunk are raised. A bed position where the head and trunk are raised. Are raised. A bed position where the head and trunk are raised, typically between 30 or 40 to 90 angle. Okay, typically between 40 to 90 angle. This position is usually they used for the in emergency room, and also they use for the shoulder surgeries, for neurosurgeries, for dental procedures, and I think there is some kind of physical therapy procedure they also use, like if they're giving some therapy to your shoulder, so they use the Fowler position. For example, this is bigger and this is the head. Then it's up to you which angle you want, like 40 or 60 or how much. Okay, high Fowler, lower Fowler. The next position we have supine position. Supine position, everyone know what is supine position. How we are sleeping straight. Okay. The position where the patient is flat on his back. And this is also considered a rest, natural rest position. Supine position. Supine. Supine position, a position where the patient is flat on his back. Flat on his back, and also supine is considered the most natural rest position. You can also write this one. Okay. Consider the most natural at rest position. This is called supine position. How we are sleeping in the bed straight. Okay, this is supine position. The next one is jackknife position. This position not related to the physical therapy, but they put it here, so we will discuss what to do. Jackknife position, it's also known as Kraski, okay, and where the patient abdomens lay flat, like patient is in the prone, but the bed, the middle of the bed here, for example, this is bed, okay, now it is straight, but they make it like this, like Caesar, like Caesar. The patient is prone, the head is here, okay, the hip is lifted, and the leg is here. This is called jackknife position. I will share with you later with the pictures in the group so you will more know. But just keep in the mind, for example, this is a bed, and here the patient is laid down in the prone, like, and the bed angle is like this. Then after the head is here, the leg is here, the hip is lifted off. Okay, this is called jackknife position. Jackknife position, also known as Kraske, you can write Kraske. Also called Kraske. Okay, and is where the patient abdomen lies flat on the bed. Lies flat on the bed. Okay, and the bed is scissored. The bed is scissored, so the hip is lifted. The bed is scissored. Scissore. The bed is scissored, so the hip is lifted off. Okay, so the hip is lifted and the legs and the head are low. The head and legs are low. You understand, Nanika? Okay. Jackknife position where the patient abdomen lies on flat on the bed. The bed is scissored, so the hip is lifted. The head and legs are low. Okay, the next one is kidney position. In the kidney position, also the bed position same. They make it like little bit scissor, but the patient is laid down on lateral side. Okay, lateral. I will show you here in the book also. You can take it. I put some picture I think here. Okay, this was a kind of jackknife, but it's wrong. Jackknife head and head both are low, but it's okay. And the kidney position like this. Patient is laid down one side and the bed is lifted here in the middle. Okay, this is called kidney position. In the jackknife, patient is prone, and in the kidney, patient is laid down on lateral side. So, if you want to write the kidney position definition, mm, they are also in the book. The kidney position resembles lateral position, okay, and also it's called modified lateral position. Modified, okay, modified lateral position. You can write in the bracket. If someone asks you what is the kidney position, it's a modified lateral position, okay, where The abdomen is placed toward or lifted in the operate. This is usually used for the operation purposes. And bends in the body. The patient is turned on their contralateral side. One side. The patient is laid down the one side. The bed is lifted here. Okay. So here is little bit of legs and head is down. Done? Okay. Prone position. Prone. P-R-O-N-E. You know already, yes? Prone position. We're using it too much here in the practical. This is prone position. If you lay down on the stomach, okay, this is like they are doing for the mechanical modalities, massage or anything. This is called prone position. But you will not tell the patient to lay down prone because the patient will not understand what is prone. This is just for your knowledge. Maybe the therapist or the doctor will tell you prepare the patient position prone, so you will understand what is prone. Okay, maybe he will tell you prepare the patient and Fowler position. So Fowler position, it should be in your mind like a semi-sitting position. Okay. So in prone position, the position where the patient lies on his stomach. You can write simply a position where the patient lies on his stomach. Position where the patient lies on his stomach. Done? Hmm. Fatma done? You want to write or no? You understand, no need to write, yes? It's simple. Okay, the next one is lithotomy position. Lithotomy position. This position is usually used in the childbirth, delivery time, okay, gynecological purposes. This is called lithotomy position. The patient is lying flat, like straight, and the legs are up, elevated, okay, to the hip level or above. Okay, this is called lithotomy position. This position involves the patient's lying flat on her back with the legs elevated to hip level or above. Simple if you want to write the definition. And this is usually used for gynecological procedures and childbirth. Okay, there in the pictures also there, but you already know, understand it. The next one is sim position. Sim position. Okay, sim position also called semi-prone. You can write in the bracket semi-prone. So if it's semi-prone, so it's mean it's like a half prone. Prone position is like this, yes. So if semi-prone, so it's mean it's a half prone, like the patient is laid down one side but in little bit prone, and the one leg is flexed to the chest, and the other leg is straight. This position also used for the clean enema or rectal examinations, okay, and clean enema procedure in the hospital. Semi-prone, you can write in the bracket. This is also called semi-prone position. And some people also sleeping like they sleep like one leg here. Some people put here pillow or something. Okay, this is called semi-prone position. Eh? Yeah, kids. Yeah, mostly kids. Mm. Mostly the adults also, some people feel relaxed, and this is also a relaxed position. Okay, the patient assume a posture halfway between the lateral and prone position. Okay, you can write a patient assumes a posture halfway between the lateral and prone position. This is between the lateral and prone. So now you understand. You are not lateral, not prone. Okay? Understand? Hmm? Same position, understand, or no? Still you are confused. Little bit confused. Wait, you in the last you open there is picture or no privacy from. Yeah, in the definition I can tell, but if you not see in the picture, you this one. See, the upper leg is flexed, other leg is down, and the patient is half prone, lateral one side and prone this one also. Mostly people are sleeping like this. This one also, see, this is from back side. Now you understand. No. This is called. Hmm? The up leg. This one. This is from back side. This is from front side. Hmm. Semi prone. Like no, you are not prone. Not. This is wrong. This is they put it, but it's not. They just took some pictures from anywhere and put this in the book. Now you understand? Yes. Okay. So you can write or the same position. This is also called semi-prone. 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 The patient assume a posture halfway between lateral and prone position. Okay. So now the next one is lateral position. Already you know it. Lateral position. Everyone know what is lateral position. Hmm? You are lay down one side, left or right. Fatima, you know lateral position? Lateral. One side sleep. Yeah, straight one side. Okay, left or right? It's okay. This is called lateral position. So the next one is Trendelenburg. Trendelenburg position. So Trendelenburg position, and this position, yeah, involves lowering the head of the bed is down and raising the foot of the bed is patient is up. For example, this is bed. See, so the head is down and the foot is up. Straight. Patient is lay down here. The head come down, and this is called Trendelenburg. If reverse Trendelenburg, then it will go like this. There is, you open the pictures. There is, and the hand should be tucked here. Okay, the hand should be tucked here. For example, this is bed, and I'm lay down here. The hand should be tucked here. This will go down the head and the legs will up. This is Trendelenburg, and if reverse, the bed will come like this. My leg will go down, also the bed same. The hand will be here. So this is called reverse. Yeah, this is Trendelenburg, but somehow it's wrong because the leg should be also straight. Okay, this is Trendelenburg and this is reverse. Trendelenburg, the head come up. So the Trendelenburg position involves the head of the bed. The head of the bed is rising. Okay, the foot of the bed of the patient. The patient arm should be tucked at their side. Just keep in the mind that the hand should be tucked. And reverse Trendelenburg, the patient position where the head of the bed is elevated. Head will be elevated, okay? With the foot of the bed down. Foot will be down, the head will be elevated. This is reverse. And if the head is down, the foot is up, raised, then it will be Trendelenburg. Okay? Yeah. Trendelenburg. And reverse. Reverse Trendelenburg is the opposite of Trendelenburg. You can also say simply this is the opposite of Trendelenburg position. Yeah, like what is the position definition, what is the purpose or goals of the positions, okay, and maybe use some kind like what is Fowler position or what is prone or supine like this. So you already know what is prone position, what is supine position, yes? Hmm? Done? I didn't give to you? Okay, I will give you today. So what is positioning? Positioning is defined as planning the person in a proper body alignment for the purpose of preventive, promotive, curative, and rehabilitative aspects of health, or placing the patient in a good body alignment as needed therapeutically. Okay, what is the goals or the purposes of the patient positioning? So prevent nerve damage, give comfort to the patient, okay, to promote safety to the patient, to stimulate circulation, to prevent complication caused by immobility, to promote normal physiological functions, to perform surgical interventions, and also to perform nursing interventions to relieve pressure on various parts. You can aid from your own self also. Okay, prevent soft tissue and musculoskeletal and other patient injury. Then Power position is like a semi-sitting position. Okay, and the next one is supine position. Supine position is like a natural rest position. We are laying on our back. And the next one is jackknife position. It's also cross key. The bed is scissored in the middle, so the hip is lifted. Kidney position. Also, it is called modified lateral position. Okay, patient lay down one side, but the bed is lifted in the middle, same like in the jackknife scissor. So the next one is lateral. Already you know, patient lay down one side, left or right, same position. This is also called semi-prone position. Okay. Trendelenburg position. The head will be down and the foot will be up the bed. And reverse, the foot will be down and the head will be up. Okay. Lithotomy position. Already you know, it's mostly used for the gynecological procedures. Okay, in childbirth time. So in this modules, only these things are important. The next one, thank you.